Hi students, welcome home to Mass. Today we shall discuss about clinical correlation of posterior triangle. First one, why does a patient struggle to comb hair after a simple cervical lymph node biopsy? That's because spinal accessory nerve is prone for injury during removal or biopsy of cervical lymph nodes. Now, this is spinal accessory nerve which supplies this muscle, that is the trapezius muscle. Spinal accessory nerve supplies trapezius, and trapezius helps to abduct the upper limb above the head level, as in combing the hair. Now, surrounding this spinal accessory nerve, there are lymph nodes. So, these are cervical lymph nodes. So, the answer to this question is spinal accessory nerve is prone for injury during removal or biopsy of cervical lymph nodes. It may lead to paralysis of trapezius muscle, and that is causing difficulty in combing his or her hair. So the second question, how does a cold abscess from cervical vertebral tuberculosis reach the axilla via the posterior triangle? That means pus from the cervical vertebrae tracks down to the axilla. How? That's because of prevertebral fascia and its extension, the axillary sheath. Let's discuss. This is cervical vertebrae, which is covered with the muscles called as prevertebral muscles. So the cervical vertebrae and the prevertebral muscles are covered by a fascia. This fascia is called as prevertebral fascia. So we'll mark this as prevertebral fascia. Now, the second point, in front of the first rib, that means in the subclavian triangle, which is a part of posterior triangle, the very important content is subclavian artery. So, this artery is subclavian artery. The other content in the posterior triangle, that is in the subclavian triangle, is the trunk of, these are the trunks of brachial plexus. So we'll just mark this as trunks of brachial plexus. Now the third point, this prevertebral fascia will extend laterally to cover the trunks of brachial plexus and the subclavian artery. Apart from the same, it will also form the floor of the posterior triangle. Now, what happens next? This subclavian artery will continue down as axillary artery. So, this artery is axillary artery. Axillary artery, and the trunks of brachial plexus will further divide, and then it will form the cords of brachial plexus with its branches in the axilla. Now, this prevertebral fascia, which was covering the subclavian artery and the brachial plexus, will now form a tubular sheath surrounding the axillary artery and the trunks, that is the cords of brachial plexus, to form something called as axillary sheath. So axillary sheath is a continuation of prevertebral fascia surrounding the axillary artery and brachial plexus. Now coming to the point. Now imagine an abscess over here, which is in one of the tubercular cervical vertebrae. The abscess from this region tracks down beneath the prevertebral fascia and it will appear in the posterior triangle. From the posterior triangle, it will track down along with the axillary sheath and it will appear in the axilla. This is how a cold abscess from tubercular cervical vertebrae will first appear in the posterior triangle and then in the axilla. So from exam point of view, in tubercular cold abscess from cervical vertebrae, the pus may track along prevertebral fascia in the posterior triangle and then into the axillary sheath and finally it appears in the axilla. Third question, what is the most common cause of swelling in the posterior triangle? That's because of it is the lymph node enlargement. Have a look here. These are the cervical lymph nodes in the posterior triangle. These are the supraclavicular lymph nodes. The supraclavicular lymph nodes of the left side are called as Virchow's lymph nodes and they are very important clinically. So these supraclavicular lymph nodes are enlarged in conditions like tuberculosis, Hodgkin's disease, or malignant breast. Whereas the left supraclavicular lymph nodes, these are otherwise called as Virchow's lymph nodes, are enlarged in metastasis from cancer, stomach, or testis, or any abdominal organs. So these left supraclavicular lymph nodes are extremely important for the pathology of abdominal organs. So these are left supraclavicular node enlargement which are called as Virchow's nodes and the sign is called as Troisier's sign. Now how does the cancer spread from this abdominal organs to the supraclavicular? It is through lymphatic vessels. Which lymphatic vessel? The largest lymphatic vessel, that is thoracic duct. Thoracic duct opens here on the left side at the junction of internal jugular vein and subclavian vein. Fourth question, where is the pulsation of subclavian artery felt? It is at the root of the neck, behind the lower end of this muscle, that is the sternocleidomastoid. This artery is subclavian artery. So this is the subclavian artery which is pressed against this first rib. So this is the first rib. So pulsations of subclavian artery are felt at the root of the neck, lateral to the lower end of sternocleidomastoid muscle, pressed onto the first rib. So that was the clinical correlation of posterior triangle. Thanks for watching. Please share your valuable suggestions. This is Mars, where medicine meets meaning. Thank you.